Greetings. Let us talk about the etiology of ascites. I want to thank many who support this program, and please read the notice. When you see somebody with ascites, you want to figure out the underlying mechanism for the ascites. I superimpose this image of the heart, the liver, and the peritoneal cavity to help you understand the mechanism of ascites. The most common cause for ascites is portal hypertension related to cirrhosis of the liver, and you could also have portal hypertension if the patient has heart failure and the pressure is transmitted from the heart via the inferior vena cava hepatic veins into the sinusoids of the liver and result in portal hypertension as well. The second most important cause, other than portal hypertension, is peritoneal irritation related to either cancer or tuberculosis. So, two important causes for ascites: portal hypertension, peritoneal irritation. And how do you differentiate these two? By analyzing the ascitic fluid and serum albumin. You calculate the serum-ascites-albumin gradient. If it is more than 1.1, you think about portal hypertension as a cause for ascites. Less than 1.1, you think about peritoneal irritation. So let us talk about when you see somebody with ascites and you think about heart failure, you should be able to diagnose heart failure as a cause for the ascites by looking at the signs of right heart failure. Jugular venous distension. You may have a tricuspid regurgitation murmur, or you may have signs of pulmonary hypertension with a right ventricular strain, evidenced by a loud pulmonary component of the second sound, indicative of pulmonary hypertension, and a parasternal heave, indicative of right ventricular strain. And you could also find that the patient has heart failure by looking at markers in the blood, especially the natriuretic BNPs. So when a patient has ascites and a serum ascites albumin gradient of 1.1 and you think it is heart failure, you don't need to do any other tests on the fluid. Do not waste sending a bunch of tests. Instead, check the heart function by doing an echocardiogram. On the other hand, if you see somebody and you think it is cirrhosis of the liver and their serum ascites albumin gradient is 1.1 and they don't have any evidence of heart failure signs, then you don't need to do any more tests on the fluid. When I say any more tests, sending it for TB, sending it for cytology, etc. And what you should go for is evaluate the liver by doing an ultrasound that includes a Doppler to check the flows in the portal vein, flows in the hepatic vein also. And you may also consider imaging, cross-sectional imaging with either a CT or MRI to see if there is any other problem other than cirrhosis of the liver. especially liver cancer. So now, when you see a patient where the serum ascites albumin gradient is less than 1.1, you should be thinking of peritoneal irritation, uh, and cancer is one of the differential diagnoses. And these patients behave differently. They tend to have weight loss. Uh, they may have lymphadenopathy. Uh, think about the supraclavicular lymph node, and they may have masses on palpating the abdomen. And also think about gynecological causes of cancer, especially ovarian cancer. So when the SAG is less than 1.1 and you suspect possibility of cancer, it's important to send the ascitic fluid for cytology. And imaging, cross-sectional imaging will also be helpful. In some cases, you may even need a laparoscopy to evaluate the underlying pathology further. On the other hand, if the SAG is low, it is peritoneal irritation. And if the patient is coming from an endemic area where tuberculosis is prevalent or an immigrant from that area, you should consider tuberculosis. And these patients may have other systemic symptoms like low grade fever, night sweats, anorexia, weight loss, and they may have lymphadenopathy. They may have findings on the chest exam. So, when you think about tuberculosis, you should send the fluid for TB and ADA levels. And imaging may help. And in some cases, they may need a laparoscopy also to look for peritoneal tuberculosis. So, two important causes for ascites: portal hypertension, peritoneal irritation. Portal hypertension, cirrhosis, and heart failure. Peritoneal inflammation or irritation, cancer, tuberculosis. A SAG of more than 1.1, you should think about portal hypertension, either cirrhosis or heart failure. A SAG of less than 1.1, most likely not portal hypertension. Think about peritoneal irritation, cancer, or tuberculosis. I hope this is helpful, and I want to thank authors of this beautiful guidelines, and you could read that for further information. Thank you.